Welcome back to the Morning Blend. Well, let me ask you a very important question. You could say it's a matter of life or death. Are you at risk of having a heart attack? Certain things will help you make a good guess. Your age, your family history, obesity, diabetes, but nothing is as good as taking a picture of your heart.
And there's a new scan that can do just that with less radiation, and it's more affordable than ever. Dr. Michael Becker is a board-certified cardiologist, and Mr. Michael Coleman is the director of radiology at Vital Body Scans. Thanks for being here, gentlemen.
Well, thank you.
Nice to have you.
I think this is wonderful. We were talking during the break about the scans, which we'll get more in detail to in just a minute, but let's just start with a little overview of your clinic and exactly what you do at Vital Body Scans.
Well, Vital Body Scans is a clinic located in Franklin, and in fact, we're located just south of Highway 100 on Loomis Road. And what we offer there is actually a CT scanning, and obviously these CT scannings allow us to do certain screenings. We have a menu of screenings that we can look at the abdomen, the pelvis, lungs, heart scans, bone densitometry, and CT colonography, otherwise known as virtual colonoscopies, but again, a non-invasive way of looking, screening for colon cancer. But in this case, today we're talking about heart scans.
And that's because it's February. We've been talking this month about it being Heart Month. And I wonder about these CT scans, why it's important for people, as you see it, doctor, for people to be proactive and to really have an accurate idea or picture of their heart and their heart health.
Well, I'm by trade an interventional cardiologist, and I see people after they've developed obstructions or had heart attacks, and they need improvement in their circulation. And over time, it's become obvious that prevention is where it's at. Nobody wants to get to that point where they have a heart attack, require a stent or an angioplasty or bypass surgery. And CT scanning of the coronary arteries is a very useful, non-invasive way of finding out if plaque has developed.
Well, and as you mentioned, I think it's true, we're a very reactive society when it comes to our health, and we need to be more proactive. How accurate do you think the scans are for somebody who wants to get this done?
It's very accurate. What we're measuring in the scan is the presence of calcium in the walls of the coronary arteries, and that's been proven to be directly correlated with the amount of plaque that's there.
So it shows you kind of that buildup? Is that sort of what it shows, how,
Yes.
how maybe constricted the vessels are?
Not how constricted the vessels are, because we're not actually looking at the vessels. We're
Okay.
looking at the amount of calcium that's present, which directly tells us how much plaque volume there is.
Important.
There's a big difference between men and women, I think, as it relates to heart health, particularly as it relates to the symptoms that they notice. For men, for example, the sensation of heartburn, heaviness in the chest, difficulty breathing, pain in the left shoulder sometimes are very common. Women's symptoms, though, are not as patterned. Because of this reason, it seems like, in a way, it'd be more important for women even to have this scan than men. Is that fair to say?
It is, it is. It's quite fair, because that's one reason, is that symptomatically heart disease is more difficult to diagnose in women because of the fact that the symptoms aren't as classical or textbook as they are in men. But another factor is the fact that women are in general smaller than men. Their blood vessels are smaller than men's, and the amount of plaque buildup required to cause obstruction is less.
Well, and there's a lot of people who have no symptoms at all.
That's right.
And that, to me, is the scariest, that you could have that. You know, I know that there's several different types of technologies. There's the CT imaging, and you have the EBCT. What's the difference between the two?
Well, actually, the EBCT scanner is a CT scanner, but more so, it was developed back in the 90s. To do just that, to look at heart, because it's actually referred to as the ultra fast. In other words, when it takes its image, it actually, because of its speed, is actually to catch the heart in a static image, so it's such that when you score the heart or the vessel itself, it's most accurate, because there's no blurring, as you will, and that's the whole purpose of the EBCT. You also the EBCT, using a little bit different technology, and also with the protocols we use, allows us to do imaging of these screenings at about 10 to 15% or times less radiation than all the other CT scanners out there that are currently used.
And that's a big concern of people, isn't it?
It's a huge.
There are other CT technologies that can be used, but all of them require much more radiation to create these kinds of images.
Right.
Well, you know, it's interesting because we talked about knowing your risk. You know, do you have a family history? Are you obese? Do you have diabetes? Are you a smoker? These are all risk factors. But this sounds like you can know with much more certainty if you're truly kind of in line to have a heart attack or some type of heart problem.
That's right. The risk factors that you're referring to add up to a statistical probability. For example, in your case, you might have 3 risk factors, and that'll give you X risk of having heart disease. That tells you what your odds are, but it doesn't tell you if you have it. So in an individual case, this is a way of measuring the presence of plaque and its volume to determine what are the odds that I really do have a problem.
Well, and I bet a lot of people are surprised that they have a problem, and maybe they don't have a family history, and they're not obese, and they don't smoke.
That's all true, and some of them are also exonerated in the same way.
Yeah.
Yeah, right? It's true. But you've had a patient that came in. Just talk a little bit about that patient who came in, had no symptoms, took a scan, found out that he had, what, 98% blockage in one,
That's right.
93% blockage in another artery, and he ended up having to have surgery.
That's right, and he was asymptomatic. And he just came in for a screening scan and was found to have very severe disease.
Wow.
I know that you had a scan yourself, right? Were you surprised at the results?
You know, I was to a certain extent. I mean, obviously, you know, when you find out that you do have this risk for a heart attack, you know, it does modify your lifestyle. And so in the last couple of years, I've kind of been watching, you know, how I eat, you know, following certain things like that are out there, like, you know, increasing the high density lipoproteins by doing fish oils, vitamin D, and all these things, exercising. And you know what? When you modify your lifestyle like that, you find, and in my case, I actually had a repeat exam and actually found that my plaque burden actually reduced itself to a certain degree.
That's amazing.
So it's
Yes.
possible.
That's something that we haven't really talked about, is the ability to determine whether or not the treatments we're using to reduce the development of plaque are actually having an effect. And we can calculate the rate of development of the plaque over time if there's 2 or 3 scans in a sequence.
And
Well, it's
that is
nice to know you
amazing.
can, and you
Yeah.
can help
Right.
yourself in the future by following some of those proactive steps.
Right, and doctors
For
can
sure.
show their patients the effect of the anti-cholesterol therapy that they're giving them.
That's
Absolutely.
wonderful. And right now, people can actually register to win a free heart scan. There's one per week in February, so you're giving away these free heart scans. It's vitalbodyscans.com is the website where you can go to register. You're also offering right now a heart scan special. This is celebrating Heart Healthy Month, and the scans right now are just $179. This special, though, ends March 1st, so this is a good time to take advantage of that big discount and get one of these scans right away. And you can visit Vital Body Scans at One Source Medical Center, which is located on West Loomis Road. The phone number for more information or make an appointment for a heart scan is 414-774-7600, or you can go to vitalbodyscans.com. Nice to have you both
Thanks,
here.
gentlemen.
Thank you very
Thank
much
you
for
so
having
much.
us here.
Important conversation.
Yeah.